Benign prostatic hyperplasia, BPH, treatment. A detailed guide. Benign prostatic hyperplasia is a common condition affecting men, especially after the age of 50. BPH is not cancer, but its symptoms can significantly impact quality of life. This article provides detailed information about BPH, including its causes, symptoms, diagnosis, and available treatment options. What is benign prostatic hyperplasia? Benign prostatic hyperplasia is a condition in which the prostate gland, a small gland located below the bladder and surrounding the urethra in men, increases in size over time. BPH is not cancer and does not increase the risk of prostate cancer, but its symptoms can significantly affect quality of life. Causes of benign prostatic hyperplasia. The exact cause of benign prostatic hyperplasia is not fully understood, but it is believed to be related to hormonal changes in men as they age. As men get older, levels of the hormone testosterone decrease, while levels of another hormone, dihydrotestosterone (DHT), increase. DHT can stimulate the growth of the prostate gland. Symptoms of benign prostatic hyperplasia. Symptoms of benign prostatic hyperplasia can vary from person to person, but commonly include obstructive symptoms *, difficulty starting urination, frequent urination, especially at night, incomplete emptying of the bladder, weak urine stream, intermittent urination, feeling the urge to urinate again immediately after urinating, irritative symptoms *, urgent need to urinate, painful urination, pain during urination or ejaculation. Diagnosing BPH. Your doctor can diagnose benign prostatic hyperplasia based on your symptoms, medical history, and physical exam. Tests that may be used to diagnose benign prostatic hyperplasia include digital rectal exam. DRE. The doctor inserts a gloved finger into the rectum to examine the size and condition of the prostate gland. Urine test, to rule out a urinary tract infection or other problems. PSA blood test. PSA, prostate-specific antigen, is a protein produced by the prostate gland. Elevated PSA levels may suggest benign prostatic hyperplasia or prostate cancer. Prostate ultrasound, to measure the size and shape of the prostate gland. Cystoscopy, to examine the urethra and bladder. Treatment options for BPH. There are many different treatment options for BPH, depending on the severity of your symptoms and your overall health. 1. Lifestyle changes. For mild symptoms, your doctor may recommend lifestyle changes including limiting fluid intake in the evening, reducing caffeine and alcohol consumption, exercising regularly, urinating when you feel the urge, avoiding diuretics. 2. Medications. If lifestyle changes do not improve your symptoms, your doctor may prescribe medication. Commonly used medications include 5-alpha reductase inhibitors, finasteride, Proscar, and dutasteride, Avodart, shrink the prostate gland by inhibiting the production of DHT. Alpha blockers, terazosin, Hytrin, doxazosin, Cardura, tamsulosin, Flomax, and alfuzosin uracetrol relax the smooth muscle of the prostate and bladder neck, making it easier for urine to flow. 3. Surgery. If your symptoms are severe or medication is not effective, your doctor may recommend surgery. There are several different types of BPH surgery, including transurethral resection of the prostate, TURP. This is the most common surgical procedure for BPH. The doctor removes the part of the prostate gland that is blocking the flow of urine using an instrument inserted into the urethra. Laser surgery. There are several different types of laser surgery, including green light laser, holmium laser enucleation of the prostate, HOLEP, and RISM. Laser surgery is generally less invasive than TURP and may result in less bleeding and a faster recovery time. Other minimally invasive procedures. In addition to TURP and laser surgery, there are several other minimally invasive procedures to treat BPH, such as UroLift. Which treatment option is right for me? The most appropriate BPH treatment option for you will depend on several factors, including severity of your symptoms, size of your prostate gland, overall health, age, your personal preferences. Your doctor will discuss the different treatment options with you and help you make the best decision. When should I see a doctor? You should see a doctor if you have any symptoms of BPH, especially if the symptoms are affecting your quality of life. Seek immediate medical attention if you experience any of the following symptoms: pain in your abdomen or genitals when you urinate, pain, fever, and/or chills when you urinate, blood in your urine, inability to urinate. Tips: BPH is a common problem in men, especially after the age of 50. There are many different treatment options for BPH, ranging from lifestyle changes to medication and surgery. The most appropriate treatment option for you will depend on several factors. See your doctor if you have any symptoms of BPH. I hope this information is helpful. If you have any other questions, please do not hesitate to ask.